Hello, my name is David. I am the liver transplant dietitian at University Hospital in Newark, New Jersey. I came on to share with you some general nutrition information and some education in regards to the liver and its nutrition in the pre-transplant process. I do have some notes on the side with me, so if I am looking a little bit all over the place, I'm just looking at my notes to make sure that we keep on track, stay organized, and get you the best nutrition information. So I think what's important is to know the liver's function. The liver is the largest or one of the largest organs in our body. And it plays an important role in our metabolic function. And what I mean by that is that it converts different sorts of substances and nutrients in our diet for our body to use. So it can store proteins, it can store our starches or our carbs for us to use as energy later, and it supplies our cells with different types of nutrients to use as needed. So it's super important in our overall nutrition composition. And unfortunately, with liver disease, there come some complications in this process. And liver disease is known as a catabolic illness, meaning a lot of protein and energy is, used for the body. And that pretty much means that any patients undergoing liver disease have a higher need for calories and protein in order to maintain a normal functioning process for the liver. And if you're not able to meet those needs, then what happens is your body starts to pull from its reserves and you lose a lot of lean body mass, which pretty much is your protein storage for your body to use as energy. And that can lead to what we call malnutrition. And malnutrition is pretty much a fancy word for saying that your body is not getting enough nutrition that it needs in order to function normally. And it starts using anything that your body has left over to keep on track. And I'm going to talk about certain ways that we can kind of help aid in any of these situations and prevent further muscle breakdown in your pre-transplant process. As I said earlier, that protein becomes very, very important in managing our liver disease, and we have higher requirements for protein in the body. So what I mean by protein is anything from chicken, turkey, fish, your low-fat dairy products, eggs as well, and also our plant-based proteins. So we can't forget about your beans, or also known as legumes, your seeds, your nuts, your nut butter spreads, and also soy-based products. Of note, and we should keep in mind that our red meats, such as your pork, your lamb, and your beef, should be limited. Reason why is because they have a higher ammonia content. And with liver disease, what happens is your body is unable to detox or get rid of the ammonia content as efficiently as what we consider a normally functioning liver. So that buildup can lead to what we call encephalopathy, which is also known as confusion. So to prevent that from happening, and the ways to manage it with nutrition and how you can kind of prevent that from getting worse with complication is by avoiding or limiting your red meat intake. Of course, medication is the main use for ammonia buildup in the body, and that will be deferred to our doctor and our clinical staff team in order to kind of manage your medication. But in terms of nutrition, just remember to limit the red meats and focus more on your lean proteins, anything with fins and feathers, and your plant-based proteins, making sure to consume them with every meal and try to eat the protein food first in order to prevent further muscle breakdown. Another thing to look out for when dealing with liver disease is fluid buildup. This is mostly identifiable in the lower extremity and the abdominal region. The abdominal region is known as ascites, and of note, your physician will work closely with you to manage your medications and schedule any fluid removal procedures that are necessary in order to remove excess fluid buildup in your body. However, nutrition does play an important role in managing this, and we do recommend all of our patients to consume a low sodium diet of less than 2,000 milligrams of salt per day. What I mean by this is throwing away the salt shaker can really, really help in the overall picture of fluid buildup. So adding extra salt is a big no-no. We want to make sure that we use natural herbs and spices. There are products out there that are naturally spiced brands that you can use as substitutes in order to flavor your foods and make them more tasty. We do want to limit how many canned food products we consume in a day because those usually use salt as a preservative. So canned vegetables, I do recommend that you switch over to frozen if it's more economically feasible. However, I do understand that sometimes it is unavoidable and we do need to purchase can-based food products. So what's important is looking at that label and making sure we're looking for things that say low sodium on the label or no salt added, and turning it over and looking at that nutrition facts label, which we can go over together in order to identify how much salt is in a serving. Specifically, you want to make sure that the servings for low sodium is less than or equal to 140 milligrams per serving. I also want to touch upon the fact that appetite may decrease when dealing with liver disease, and this may be due to various different aspects. Sometimes it's due to a lot of the fluid buildup and pressure sitting on the stomach, which can lead to early fullness or early satiety. And you're unable to finish your meals. And it's very important to get enough nutrition. So if we're unable to finish our meals, we're not gonna meet those increased needs. So ways to help manage this is to split your meals into smaller, more frequent meals throughout the whole day. So if you're used to 3 meals a day, try 6 meals a day spaced throughout your whole time frame. Of note, just make sure that those 6 meals are smaller and more frequent than your big 3 meals a day. And include a protein source with each of those meals. Very, very important in order to preserve our lean body mass. So if this is still a complication, we can recommend nutrition oral drinks in order to help meet your calorie and protein requirements. These drinks have higher calories and sufficient amount of protein and also micronutrients and vitamins and minerals in order to sustain our body. I don't try to use these as much as meal replacers as I can. However, sometimes I understand that it's easier to drink your calories than it is to eat solid foods at that specific time. And we can work together in order to find the best regimen for you. But there are options out there. But we do want to try our best to focus on our foods first. However, we do have secondary options in order to assist you in meeting your nutritional needs. The last and also still important thing when dealing with liver disease is to avoid taking herbal supplements unless authorized by your physician. They can have interactions with other medications and can cause further liver damages, and their purity is not regulated by the FDA, so it's not possible for us to know if it's safe or not. The research still is not evident, unfortunately. So just be careful when taking certain oral herbal supplementation, and talk to your physician or your liver transplant provider in order to see if it's safe based on the medications that you are taking. So that's the last thing I kind of wanted to talk about with you guys. Just remember, food safety stays and remains very important. Avoiding raw foods is also important as well. Try not to have any raw sushi at all or ceviche. I know I'm from Spanish background and that's something that's incorporated in our diet, but if I was dealing with a liver disease or a liver complication, I would have to avoid that. So raw food is also a no-no. And that is pretty much it. I look forward to working with you one-on-one, and hopefully we can come up with a great nutrition care plan for you to help manage your liver disease.